professionals, patients, and their families. So today we are honored to have Dr. Jose Filipe Alvarez, a gastroenterologist from Goa, as a guest speaker. With several years of experience in the field, Sir is known to provide exceptional care to his patients, and his commitment to patient-centered care and spreading awareness about fatty liver disease is truly commendable. So we are grateful for his dedication to improving liver health and educating others about this important topic. So without further delay, I would like to invite Dr. Alvarez to share his valuable insights on fatty liver disease. Over to you, sir.
Yeah, good evening. And I'm talking on one of the most important liver diseases in the world called as a fatty liver disease. Now, initially, this was called as a non-alcoholic fatty liver disease, but this terminology has been changed in 2020 to call as a metabolism associated fatty liver disease or MAFLD. Now, why this is important? You see that our lifestyles are changing. There's so much of obesity, overeating, hypertension, diabetes. At least in the state that I am, Goa, they say about 40% of the adult population above 40 years have got diabetes. And we know that about 70 to 80% of diabetics are going to have fatty liver. And you see the children of nowadays as compared to about 2, 3 decades back, they are more into devices and inaction and having pizzas and burgers rather than being on the field and working out. So we see a lot of obesity, a lot of liver dysfunction and other dysfunctions due to this so-called fatty liver. So, considering even our own prime minister has taken a note of that, that there's so much of obesity and metabolic associated fatty liver disease that even the AIMS hospital, I think it was in Nagpur, has issued warning on certain foods like dosas. I'm not dosas, like samosas, which they say can cause liver dysfunction. Now, what is this metabolism associated fatty liver disease? Basically, it means there's an increase in the fat content in the liver. It goes to more than 4 to 5% of fat, especially triglycerides. So, how do they come to the liver? So, actually, there are two hits when we have this called fatty liver disease. The first hit is you have a normal liver, and due to conditions like obesity, hypertriglyceridemia, diabetes, hypertension, it can cause a damage to the liver. That's called the first hit. And you get an insulin resistance. With that, you get a fatty liver. More damage happens due to free radicals. And then the liver dysfunction from a plain fatty liver can progress to hepatitis, it can go into cirrhosis, or it can go into cancer. That's called as the second hit. Now, considering that we have a growing obesity, and changing lifestyles, it is important that we take few precautions so that we can avoid unavoidable consequences of this fatty liver. Now, what are the liver consequences of this fatty liver? They can either come with just a plain scan showing fatty liver where they are asymptomatic, or because the capsule of the liver is getting stretched when the liver is enlarging, they can come with pain in the right upper quadrant. A little bit more serious variety would be if they come with jaundice and liver dysfunction, and you find something known as a steatohepatitis. Even worse would be if you have got something known as a cirrhosis, or you find nodules on the liver which look like cancer. So these are the liver spectrum of a metabolism associated fatty liver disease. But besides the liver, a fatty liver disease can be associated with a number of non-liver conditions, right from hypothyroidism in the endocrines. It can be associated with diabetes. Then in the heart, it can be associated with plaques, it can be atherosclerosis. So you can have atherosclerosis in the coronaries, You can have atherosclerosis in the carotids. So they can come with strokes. They can come with MIs. Then they can come with kidney dysfunctions. They can have an association with a polycystic ovary in young girls. They can come with hypopituitarism. They can come with osteoporosis. So you can see that every specialty, a patient may go there, but there can be an underlying pathophysiology. Mostly, it's going to be something like an insulin resistance. How do we diagnose this metabolism associated fatty liver disease? Now, most of them do not come with complaints. They have come for a health checkup. And on a health checkup, you have found the ultrasound showing fatty liver. A few percentage will come with a raised liver enzymes. When they come with the raised liver enzymes, it is usually the SGPT is more than SGOT. If you find there's a reversal, that is the SGOT becomes more than SGPT, number one, either the diagnosis is something else or this so-called fatty liver disease has progressed to cirrhosis. Now, once they have got cirrhosis, they can decompensate. So they can come with ascites, they can come with GI bleed, jaundice or encephalopathy, or right from the fatty liver, they can come with a hepatocellular carcinoma. So the main diagnostic test to detect fat will be an ultrasound. What about the fibrosis? There are two components. There's a fat and there is a fibrosis. Fat is very easily detected. Either you do an ultrasound or you can do a CT or MR can detect fat. But what about the fibrosis? So we do something known as a fibroscan. Now, this is a type of an ultrasound guided device which tells you the amount of fibrosis what you have got. The third component of this is the inflammation. Now, this inflammation cannot be detected by ultrasound or by fibroscan. In the good old days, we would do a liver biopsy. The liver biopsy would have shown a balloon hepatocytes. And like how alcohol has got Mallory hyaline, you could also get it in non-alcoholic fatty liver disease. So balloon hepatocytes, then you would have got a Mallory hyaline. So a features resembling an alcoholic hepatitis. But now we have got certain biochemical markers or a combination of markers. Many of these are available, like a FIB test, etc., or a cytokeratin 18, etc., which can show. But these are more for academic interest rather than a daily life use. Once you diagnose that somebody has got a metabolism associated fatty liver disease, we have to see, does he have diabetes? No diabetes. Is there a lipid dysfunction, especially hypertriglyceridemia? Is there a uric acid which is raised? Is there a obesity? So, or hypertension. So these things have to be addressed. And the main component of therapy for a metabolism associated fatty liver disease are two: diet and exercise. Now, exercise, they say both aerobic exercise and weight training exercises must be done. And we require about 30 to 40 minutes of cardiac fitness. We may also do weight training exercises because that prevents sarcopenia, which can worsen the fatty liver. As far as diet is concerned, it is important to know that fruits containing high fructose we must avoid. Oily foods, then beverages like Coca-Cola, Fanta, which contain high sugar, must be avoided. And diet, which is preferable, is a Mediterranean type of diet, more of vegetarian type of diet. If we are meat eaters, it is better to have white meat rather than the red meat. Red meats are beef, mutton, pork. That's called red meat. Even about the white meat, when we are eating chicken or fish. Now, for chicken, it's better that we avoid the legs of the chicken because that contains more fat as compared to the breast of the chicken. And the way we make the chicken will be preferable that it is done either as a boiled chicken or in a curry chicken rather than a fried chicken or a fried fish. Now, if the liver enzymes are raised and you have got dyslipidemia, then we would like to add certain medications. The two common medications which were there for a number of years, one was the good old vitamin E, and the second thing is called as a saraglitazole, which is a PPAR agonist. Now, we would prefer the PPAR agonist for people who have got dyslipidemia with fatty liver disease. The others could be started on a vitamin E 400 milligram BID. How long should we give this therapy? They recommend to give it for 2 years. But there's a small caution. When we give vitamin E, remember, there have been studies which have said that long term use of vitamin E for more than 18 years has been associated with a slightly increased risk of prostate cancer. So we have to take care that are we giving vitamin E in the elderly? Are they young? How long are we going to give? Does he have a stroke? Because vitamin E can sometimes be associated with the hemorrhagic strokes. So we have to take care. When we are evaluating the patient, it's always better that when, of course, after doing an ultrasound, that we do a carotid Doppler also to see for atherosclerosis in the in the carotids, and also get a coronary evaluation done. So the cornerstone of therapy is exercise and diet. If that doesn't work, we go for the second line, which is drugs. Drugs are going to be a vitamin E and PPAR agonists like saraglitazole. Of course, if someone is obese, now drugs have come for obesity. They're also available in the Indian market. But in maybe a decade ago, if we had found someone was obese together with a metabolism or fatty liver disease, we would have sent them for a bariatric surgery. But now drugs are available and they say you can achieve a remarkable weight loss with those drugs which cause weight loss. And if you have got the last component of a metabolism associated that is called a decompensated cirrhosis, and that has got a MELD score of more than 14, then probably this person has to be evaluated for liver transplant. The bottom line of this talk is it is important that we prevent or slow a progression in case somebody has got a fatty liver. Important that everyone at least gets a basic ultrasound done. If ultrasound shows a fatty liver disease, then obviously it requires evaluation. And it's important that we tell our youngsters it's important to have a balanced, healthy diet, preferably a Mediterranean type of diet, exercise daily, avoid high sugary fruits and beverages. Coffee has been found to be good. And when we say coffee without milk. And not the instant coffee, but the filtered coffee. They say taking 3-4 cups of coffee per day can be associated, can regress the fatty liver. So we would encourage people to drink coffee, drink 3-4 cups of coffee per day because it is quite good in the fatty liver. It's beyond the scope of today's talk to discuss the mechanisms how coffee regresses the fatty liver. So bottom line is it's a growing concern. It's the commonest liver disease. It's the commonest cause of abnormal LFT in the community. And it is preventable or we can prevent the progression if we take care. Thank you.
Thank you so much, sir, for this wonderful talk. This has enlightened us. Now, sir, with your permission, I would like to ask few questions from you. The
Go ahead.
first question we received from audience is, sir, how common MASLD in Indian population?
How common is
How common MASLD in Indian population?
it is extremely common. In fact, it is the commonest liver disease in the world and in India. If you have an abnormal LFT in 10 times, you are going to be right if you think of MEFL.
Okay. So next question is, what is ideal diet recommendation for MASLD patients?
The dietary recommendation is preferable to have more of a Mediterranean type of diet with of olives, vegetables, leafy vegetables. Avoid oily foods. Avoid high fructose diet. Avoid aerated beverages like Coca-Cola, Fanta, which contains a very high sugar. And if you are a meat eater, lean meats or white meats like chicken or fish, but made either in a curry or which is boiled, not fried.
Okay. And so, what is your message to people watching this live who have been told that they have fatty liver disease?
I think the most important thing, don't panic. Exercise, exercise, exercise. Number two, take care of your diet. Number three, go for regular follow ups. It doesn't mean to say that you exercise today and you got an ultrasound today, you're not going to repeat your ultrasound after 6 months, 1 year. You have to do because there is a chance of progression of the fatty liver disease. There's a chance of getting a symptom without knowing you can get a cancer into the liver. So we have to follow up, get regular health checkups, take care of our diet and exercise.
All right, sir. Now, on behalf of Nash 24 by 7, I extend my sincere thanks to Dr. Alvarez for his enlightening and engaging talk on fatty liver disease. Sir's insights have highlighted critical need for increasing awareness about fatty liver disease, and I also want to express my appreciation to our audience for their participation and valuable contributions. Your feedback and suggestions are essential as we strive to enhance our future Facebook Live programs. Please stay connected with Nash 24 by 7 on Facebook for upcoming updates and information. Take care, stable. Thank you so much, sir, for joining us today.
Thank you.
Thank you.